Hello, everybody. I'm Professor Paul Lee. I work in 108 Harley Street. Today, I'm going to talk to you about Arthrosamid, a new injection that has been made available in the UK to treat patients with osteoarthritis. So a little bit about my practice, about my background. I am an orthopedic surgeon, so I do treat hip and knee problems, and I do knee replacement as well. I can see how useful it is, but at the same time, and how invasive it is. And I got my other hat is sports medicine and regeneration medicine. This is something that I spend a lot of time off to try to improve patients' life by not doing surgery and try to prevent them having any surgery. So based on this, in my interest, this is how I come across Arthrosamid, so which I will talk to you a little bit more later. I am also a visiting professor of sport medicine as well as engineering. So my background is medical engineering. So when I look at a new product or new procedure or new implant, I will apply engineering brain into it as well as the regeneration method and treatment. So let's talk about regeneration medicine and about this new Arthrosamid injection. This is what we're here for. So Arthrosamid is come in a box of 6 syringes because the substance is very, very thick and it can be injected into the joint. We have done many of this Arthrosamid injection, and it has been doing really well for patients. Arthrosamid is a hydrogel. For short, we want to call it IPAAG because otherwise you're going to call it polyacrylamide hydrogel injection. So I think IPAAG is a little bit easier than polyacrylamide hydrogel. What it does is basically it's a gel, is non-biodegradable, non-bioabsorbable. It stays in the body. The way that I see it as an orthopedic surgeon is that it is an injectable implant to the body. It is perfectly safe. It has been used in the human body for many years, over 20 years. It's been used on the face as Acromid. It's been used in horses. It's been used in vet. You may read on the newspaper to talk about how Arthrosamid or Arthromid have helped vet and help horses win the Grand Nationals. And also it's been used in urinary incontinence to bulk out the urethra to reduce patients having incontinence. So it is a drug or a substance that has been used, tried, and tested over the last 20 years. So it is a substance that we know how it behaves in the body. Yes, it is new that we use this substance. Now the company have labeled it called Arthrosamid, the IPAAG substance, to inject into the joint. So what this gel does in the joint, it works very differently to any other injections that we have ever used. So this is a schematic of how we think that it works. Instead of working in the joint between the cartilage, it actually works on the synovium. The synovium is the lining of the joint. So by influencing the synovium, and actually it works specifically on the synovium, it will help reduce inflammation. The way that I see it is that this is not a regenerative injection, but it is an injection that stops the degeneration process. So there is a fundamental difference in this injection to any other injections that's out there. This is another schematic that produced by the company, which is very new. It's very kindly they have put that into schematic to show how Arthrosamid potentially would have worked. It is the synovium with all the angry cell on number 1 here. You can see that these cells are there try to secrete the inflammatory particle, the angry particle. When the gel come along, it stick to the side and try to cover the synovium. So therefore, these inflammatory cells is no longer be able to contact to the outer surface, and therefore it will not release the inflammatory molecules. So therefore, we reduce inflammation in that way. Also, then with time, this Arthrosamid will then get taken up into the synovium, or you can see that the synovium grow over it. By doing that, when it's incorporated in the synovium, what it does is space out these inflammatory cells to stop them working together by doing so, reduce the inflammation particle within the joint. So this is a fundamental difference with this substance in comparison to any other substance that you got out there that we have ever tried. For example, hyaluronic acid, it works very differently. The MFAT will work very differently. Steroid work very differently. Traumeel work very differently. Everything that we have done so far is basically trying to work on cartilage. This is the new substance that come along to try to actually work on the synovium. So this gives the fundamental difference, and that's why this injection is very exciting on people that got more advanced arthritis. I would then want to share with you one of the case that I have done relatively earlier on for this old elderly lady, 81 years old lady. She complaining of anterior knee pain, that she got grade 4 Calvin-Lawrence scale, which is bone-on-bone arthritis basically, and got some arthritis on the medial and lateral side of the compartment of the knee as well. She walking with a stick. She cannot stand up from the chair. She have to hold onto the side of the arm of the chair before she can stand up. So you can see that her scores in terms of VAS, which is the pain scale of 9 out of 10, 10 being the worst. And then you can see the OKS is Oxford knee score, which is quite low. And then the Lystrom score, which is how active and how flexible your knees is actually very low as well. So this is a lady that initially that we have treated her with Arthrosamid injection. So this is the injection that we have done back last year. So a year ago is one of the earlier patients that we did. We can see that there is, this is her MRI scan. You can see this is some bone, what we call bone bruising or bone marrow edema. And it is something that is really important, really significant in osteoarthritis and also in the treatment and as well as on the inflammatory process. This bruising of the bone do usually correlate with severe symptoms and pain for the patient. We can see that it's a bruising on the bone on the femur. We can see it on the patella, and this is what we call a kissing lesion. So it is a very typical, difficult lesion to treat. So here we go, we highlighted this lesion for you. You can see for yourself that's on the scan back in October. That's what it showed. So of course we injected her after that, and then because she's one of the earlier patients that we have done, I have invited her back into my scanner. So it's the same scanner, and we have to then scan her again to see what actually happened within that joint. Of course, I want to see her as well afterward to see how she is and redo the scores again to see has it improved anything. But this is the picture that afterwards of the MRI scan that was done on February 2022, which is approximately 6 months down the line. And by doing that, it is you can see that the osteoarthritis and in terms of the bone bruising has significantly settling down, and that has really improved her condition. And then if I can, so you can see that pre and post. So that's at the early scan, and that's like 4 months down the line. You can see that the bone bruising is significantly reduced. And then again on the patella side as well. So even on what we call kissing lesion, it had an effect on both sides of the lesion. So of course, you know, MRIs is really good, but we're not treating the scan. We do treat patient, and we want to see how clinically different it is. So she's walking without any walking stick. To me, the most important thing that I can see from her is now she can get up from a chair without holding on to the side of the chair arm, and that is a very significant thing for her. That enabled her to do a lot of things she couldn't do before. She no longer take the tramadol, and she occasionally takes some non-steroidal. Her pain score, you can see the VAS is much improved, and her Oxford knee score is much improved, and also her Lystrom score is much improved as well to her in her perspective. So I would like to say that these are the progression of the scan. You can see that from October to April, actually, you can see the difference in terms of the change of the bone bruising, and it is very, very, very significant in terms of what I can see. So this is what I want to talk about, this new Arthrosamid injection. Of course, it is not an injection that will completely cure arthritis. Again, it is not for everybody all the time. It is something that we have good experience of, and right now I think that it is a very powerful injection that have made a significant difference in a lot of my patients with advanced osteoarthritis. Yes, of course, it's not going to work on everybody, but it is a new options, a new chance that we can offer to our patient. Thank you very much.